Okay, welcome everyone to the new publication series in European Radiology, which is called Innovation in Focus. My name is Konstantin Nicolaou. I'm with Ferdia Gallagher today.
Hello, lovely to see you.
Great to have you, Ferdia. And one of the papers that we're highlighting in this first set of publications is on new MR contrast agents, high-relaxivity contrast agents. It feels like it takes forever for the traditional modalities, TMR, to bring out new contrast agents. Now, finally, we're in the new breed of contrast agents, several of them, which are high relaxivity. What are they good for?
Well, thank you for introducing this so well. And this is a very exciting paper from Carlo Mallio, from Giles, Roditi, and Aart van der Molen. And as you say, it's looking at these new contrast agents which have high relaxivity. Now, the reason we use gadolinium agents is to look at vascularity and how that might change with disease. So the ability to be able to discriminate vascularity with changes is very valuable on many aspects of radiology, as we all know. And there haven't been many new contrast agents in the world of MR for some time, as you already mentioned. The balance there is between getting high relaxivity and being able to alter the sequence on one side versus reducing the dose in the other. There are a couple of new agents which have come out which are very exciting, and gadopiclinol and gadopapoptrin, and they're both potentially would increase the relaxivity or reduce dose, or a combination of both.
That sounds great. So if you look into the future of MR and how we deal with MR contrast, where are we going with lower doses, maybe other new technologies, AI? Will this change the way we use contrast and MR? Would it change things for patients or the environment? What is the perspective on this new way of doing MR?
Well, like all things in medicine, where we can reduce, where we give something to our patient, that is our aim. So reducing the contrast that we can administer to our patients is a benefit to our patients. Potentially increasing the quality of the images is also a benefit to our patients, to our radiologists. But you're right, maybe in the future we will combine this with AI to allow us to look at vascularity in ways which are more specific and reduce contrast even further, perhaps even not require contrast at all, as there are many new technologies that are being introduced to do that. So the future is very exciting in this realm, but fundamentally looking at vascularity is a really key thing for us in radiology.
Great. So you see, also MR is moving in terms of new contrast agents, which is great to see. Thanks for your expert opinion. Thanks for being with us, and read the paper.
Thank you for listening.